I just knew that food had rules. Food had importance. Food actually had a biblical connection, not only to your health, but to your spiritual health. If you don't do it, you're not going to teach it. And if you don't teach it, you're not really participating as a full doctor of your patients. Go to bed late, studying, and wake up at 4:30 to the gym, then the hospital. I did that for decades. But ultimately, there comes a point you got to find some balance and shoot for regular, consistent sleep. You can't make everybody happy. Consider all the options and then follow your dreams, even if your dreams disappoint some people. The real message is keep your continuing education up. The reason I have a successful solo practice is because I keep my education up. I do not know the secret to success, but I know the secret to failure. And the secret to failure is trying to make everybody happy.
If you like to be healthful, you're in the right place. My name is Raphael L. Price, and this podcast is custom built for physicians in honor of National Doctors Day. On this special day, we are doubly blessed to spotlight a luminary among luminaries in the healthcare industry, the inimitable, world record holding Dr. Joel Kahn, MD, and fellow of the American College of Cardiology and resident of Detroit, Michigan. Dr. Kahn is a practicing cardiologist and a clinical professor of medicine at Wayne State University School of Medicine. He graduated summa cum laude from the University of Michigan Medical School. Known as America's Heart Healthy Doc, Dr. Kahn has triple board certification in internal medicine, cardiovascular medicine, and interventional cardiology. He was the first physician in the world to certify, I said the first physician in the world to certify in metabolic cardiology with the American Academy of Anti-Aging Medicine and the Metabolic Medical Institute, as well as the University of South Florida. He founded the Kahn Center for Cardiac Longevity in Bingham Farms, Michigan. Dr. Joel Kahn has received several accolades and awards throughout his career, including, but not limited to, the Heart Attack Proof Award. Dr. Kahn has been recognized for his work in preventing heart disease, particularly for his promotion of plant-based diets and lifestyle changes to prevent cardiovascular issues. Recognition by the American College of Cardiology. Dr. Kahn has been acknowledged for his innovative, pioneering work in the field of cardiology, especially for integrating nutrition and holistic approaches into heart health. He is recognized as one of the best doctors in America. He has been listed as one of the top cardiologists in America, not one time, not two times, multiple times. He is a prolific speaker and author. Among all these other recognitions, Dr. Kahn is a popular speaker and author known for his contributions to health education, writing books that blend his medical expertise with his passion for promoting plant-based nutrition and a healthful lifestyle, such as The Whole Heart Solution, written in 2014. Dead Execs Don't Get Bonuses, written in 2017. The Plant-Based Solution, written in 2019, as well as his advocacy for heart disease prevention through lifestyle changes. Please join me in welcoming to the Premier Insights podcast, Dr. Joel Kahn.
Thank you very much, Mr. Price. And that was what I call an amazing introduction. Thank you very much.
Well, we are very blessed to have you here. And let me be the first to thank you for being the guest on this show and to salute you for your service as a physician as we approach this National Doctors Day. Thank you so much, Dr. Kahn. We are honored by your presence today.
Thank you.
You're very welcome. So to help our audience get to know you a little bit better, as if they don't already by that introduction, before we grace them with your advice, tell us what motivated you to pursue plant-based nutrition in your personal life and as a practicing physician.
Yeah, I didn't exactly prepare to wear a plant-based t-shirt for this interview since the interview came up relatively last minute, but I have a house full of children running around and just put on a little more casual weekend clothes, although you look wonderful, Mr. Price. Thank you for dressing up. Now, I grew up at a home in Southfield, Michigan. You're familiar, close to my office, where we kept dietary laws called kosher. Some people have heard of halal. Those are other dietary laws. Mine were no pork and no cheese and meat together. And I just knew that food had rules, food had importance. Food actually had a biblical connection, not only to your health, but to your spiritual health. But it wasn't yet plant based. And that came about when I was about 18 years old and went up to University of Michigan. Many people had to make a decision if they were going to continue in my neighborhood eating a kosher diet or relax it and give it up. And most people, frankly, relaxed it and gave it up. I just felt it was important. I felt a spiritual connection. I was dating a very nice young woman at the time who has now been my wife for 44 years. She had the same background. She had the same decision to make at a different dorm in Ann Arbor. And we both decided we're just going to eat the salad bar. It really wasn't, it was a spiritual decision, but it wasn't this massive, self-introspection. And the dorms had terrible food and good salad bars. So it actually was a pretty decent decision. And frankly, as time went on, because we have stuck with that ever since, God, I got to go back. 1977. I can't believe I can even say that. We've not eaten anything other than plant-based foods. That's called being vegan. And we have learned through being, my wife is a nurse and me as a medical doctor, of course, that there are a tremendous number of health benefits to eating a whole food plant-based diet. But at any rate, that's where it all came about, kind of an accidental dormitory thing to honor the Bible. And I'm glad to this day we kept it up.
And let me say, I could tell that this has really paid immense dividends for you, has really blessed you to look so young and to maintain your energy level. And I can only imagine that this has helped you over the course of your career with retaining all of those complex medical terminologies that you use in your medical lexicon, as it were. And so we're going to now move right into a few questions here for these young doctors that are looking up to you, Dr. Kahn. Can you share with them 3 things that every medical doctor graduating from medical school needs to do as they begin their residencies? We just celebrated Match Day, and we saw on the internet doctors all over the country celebrating being matched to the place where they would begin the next phase of their rigorous training in the medical profession. So what are 3 things that these individuals, as they graduate and begin their residencies, need to consider?
Yeah, and it will be challenging. I worked those long residency hours. It was a long time ago. I loved them. I was in Ann Arbor, up and down the stairs in the hallways of the old University Hospital, which almost nobody remembers. And then they moved in 1986 to what's now called the University Hospital, and it's not so new anymore. But, very challenging. But I think the 3 things you have to do as a young intern, a young resident, or a young staff doctor all relate to self-care. If you don't do it, you're not going to teach it. And if you don't teach it, you're not really participating as a full doctor to your patients. So study nutrition. And, you're going to probably have to study it on your own. What do? Just watch a couple documentaries like Forks Over Knives. It's on YouTube. Watch a documentary called What the Health and be curious. Are these doctors talking the truth? how come I didn't learn this at my medical school? And, is this something I need to keep learning? Read a book. There's so many, but read a book called The China Study. A lot
Hmm.
of people read that book. It's in a second edition. It sold millions of copies. The China Study, for sure. So, focus on your own nutrition, and therefore you could at least ask and teach patients about their nutrition. Second would be fitness in your life. That's going to be hard because you're going to have long hours, you're going to be tired. Fitness could be as simple as we talk about: park your car far away, walk further, take the stairs, stand more than you sit. When you're in a classroom, if you can, stay on. I always sat at the back of the room or the sides, and that gave me the ability during an hour-long lecture to get up and move around a little bit. That was a combination of a little ADD and just a little knowledge that these little activities help. And the third and final is focus on sleep. Again, going to challenge you. I thought I was invincible, go to bed late studying and wake up at 4:30 to the gym, then the hospital. I did that for decades. But ultimately, there comes a point you got to find some balance and shoot for regular, consistent sleep when call schedules don't interrupt it. So that's about the big three I would tell a young trainee or recent grad.
Thank you, Dr. Kahn. And I know that our audience will really appreciate that and benefit from that immensely in the years to come as they continue to fight through the rigors of their training and find that balance with their personal lives and what they have to do for their work and their careers. Now, I know that when you graduated from medical school, that was a few decades ago, but I'm sure that you got some very valuable advice that has been profitable for you in the following years. So, what advice would you give our new graduates as they are approaching their graduation? I believe next month in May, many doctors will be celebrating with their families all of the years of hard work that they have labored for since they were little children. And that dedication and devotion is very admirable. But what advice would you give them now as they move and take that next step in their journeys?
Sure. I had many, many great mentors, and you always got to honor your mentors. In fact, I was talking about one to patients yesterday, even though it's, again, 40 plus years ago. These memories shouldn't fade. These people were influential in your career. But my mentor in Kansas City, Missouri, where I spent a year learning to do what's called interventional cardiology or angioplasty or stenting, Jeffrey Hartzler, MD, of blessed memory, he's passed away, had a big poster in his very tiny office. And the big poster said, "I do not know the secret to success, but I know the secret to failure. And the secret to failure is trying to make everybody happy." And that's what it said. It was a poster. And he told me, if you want to do something special in life, you never want to be rude, but you're going to upset some people. You're going to, if you're paving a new path, a different path, you're going to upset some people. Status quo and the norm is the easy path. And it works out well for some people. But stepping outside, taking some pot shots, getting hit a little bit, it's good for you. And, don't worry about it so much. So, if your parents want you to be a brain surgeon and you want to be a psychiatrist, you're going to upset them when you tell them you want to be a psychiatrist. But that's okay. You can't make everybody happy. Consider all the options and then follow your dreams, even if your dreams disappoint some people. So that would be the lesson.
Very well said. Very well said. And I might add that for anybody that has elevated blood pressure because they've been disappointed or hurt, then you're talking to the right person. You're listening to the right person right now. You need to call Dr. Joel Kahn, and he'll show you how to get those levels under control.
That's good. Very good idea.
Okay, our final question. What advice would you give to doctors who are now finishing their residencies and thinking about starting their own practices?
Yeah, it's a good question. And actually, again, I had to make that decision in 1990.
Hmm.
And from 90, because that's when I started practice. I know it's a long time ago. And from 1990 through 2015, that's 25 years, I worked for other people. Sometimes it was a group I was a partner in. So you could say, well, you were working for yourself. Sometimes I was a hospital employee or an employee of a very, very large group. I had a few different situations. But you asked the question, working for yourself. And since 2015, so now just coming up to 10 years, my only boss is my wife. I got a couple wonderful employees, and I took some risks. I didn't know if I was going to be able to fill my own office. I didn't know if I was going to learn which paper copier to order and how much to spend on it. I didn't know if I'd be able to arrange, casualty insurance and disability insurance and health insurance, because my health insurance is through my small, tiny practice, and just other things. And they're all challenging, and you might want to get professional advice or a consultant. But if you can find a situation where you can work for yourself, nowadays plastic surgeons still do that. I'm trying to think of some other specialties, some neurologists, but boy, most cardiologists work for other people. And there's a risk to that. You got to keep them happy. You got to follow their rules. You got to listen, to their meetings and schedules. So I would just say, there's great joy in having good partners and peers. I've had that, and we stay in touch. But if you really want to work for yourself, which is the old fashioned medical model, there's plenty of room to still do it. Just the real message is keep your continuing education up. The reason I have a successful solo practice is because I keep my education up. You won't see me reading too many novels or going to too many, Netflix shows. You'll see me reading medical books and medical articles. I've stayed hungry all these years. Sometimes I feel like I'm just starting over because I've learned some new stuff that's so fundamental. But so stay a student for life.
Viewers today, the work you've been doing the past few decades is worthy of approbation and greatly appreciated. I'm confident that many physicians who are starting out in their careers will appreciate your magnanimity and unique approach to promoting optimal health outcomes for your patients. Thank you so much for tuning in to today's episode of Premier Insights Podcast, where we celebrate and honor Dr. Joel Kahn and all of the indefatigable physicians who keep America healthy and recovering from illnesses and injuries. If you are dealing with a heart-related issue, please give Dr. Joel Kahn's office. You can call them at 248-731-7412. And that number will be in the description at the bottom of this video here. They will be very happy to help you find the cure for your problem. Don't forget to like and subscribe to our YouTube channel to receive updates related to upcoming guests of renown. I'm Raphael Levon Price, and I pray God's richest blessings upon you in this life and in the one to come. We'll see you next time.